Thank you, everybody, for coming to this Water Quality Management Committee meeting. Just a quick reminder of some of the ground rules. If you want to speak, we'll let you speak. You have to step up to the podium or to the microphone over there. You do have to identify who you are, and you do have to stay on topic, okay? First item on the agenda tonight is an update on where the urine diversion project is from Brian Horsley, the Mass Alternative Septic System Test Center.
Take it away.
You good to go?
I'm good to go. All right, yeah, thanks everybody for having me. Again, my name is Brian Horsley. I'm a project assistant at the Massachusetts Alternative Septic System Test Center. I think as everyone here knows, we've been assisting the town with a project to look at planning for a urine diversion pilot project. So I'm here today, which is just about the 1-year anniversary of starting this project, so I think it's a great time to provide an update. So thanks for that opportunity. I'm actually going to come back to that one. So we're working with a intermunicipal agreement between the town of Falmouth and the Septic System Test Center, which is a division of the Barnstable County government. I just mentioned the project was initiated in May 2024. We're working with a team, including our staff at MassTC. We've subcontracted with a consultant team who are experts in the field of ecological sanitation, which encompasses urine diversion and composting toilets and things like that. We're also working with members of the town, the Water Quality Committee, and the Freshwater Ponds Committee as well. So our scope of work in this intermunicipal agreement is intended to answer some of the questions that came up early on in the project here about the feasibility and efficacy of how urine diversion could function as a watershed nutrient management tool. So currently we're preparing and planning to be prepared for a pilot project. So that's the work we're doing right now. The targeted completion of this planning work is September 2025, so coming up pretty quickly. And the reason for that targeted date is so that we're aligned for the November town meeting. In the case that we're prepared to go, I believe we'll be looking at asking for funding potentially for the pilot project in November. So I'm just going to pop back. So this is sort of an overview of the vision, I think, for the overall urine diversion strategy in Falmouth. So right now we're engaged in number 1, planning and preparing. If all goes well, if we achieve all the goals in planning and preparing, the hope is that we will initiate a pilot project roughly around spring 2026, following securing funding for that. And the goal of the pilot project is to install formal urine diversion systems in 50 homes throughout the town. It could actually happen in other towns as well, but really we just need 50 systems installed, and we need to monitor those systems for a period of 3 years. So that's number 2. And then following a successful pilot project after 3 years, we are hopeful that we could be aligned so that the town could then implement urine diversion as a strategy in watershed planning to help remove nutrients and meet TMDLs. So a little background, I think everybody here pretty much knows about urine diversion, but I thought I'd just back up a little bit and just answer, why are we looking into urine diversion? And I think number 1, I think there's a real efficiency benefit with urine diversion, given that around 80% of the nitrogen and around 50% of the phosphorus that enters residential wastewater comes from urine, but it only accounts for about 1% of the total volume. So if we can address the majority of the nutrients in a tiny fraction of the volume of wastewater, that's a very efficient approach in my mind. Also looking at cost is another benefit of urine diversion. We've had some preliminary estimates from a local plumber that have found that urine diversion installation in a residential home will range from around $5,000 to around $15,000. And the reason for the range there is that a very simple urine diversion system can include 1 toilet being installed on a first floor with a urine storage tank in the basement, versus a larger home where there might be multiple toilets replaced, potentially on a second floor, and also potentially with underground storage tanks. So that's why there's quite a range in costs there. And so the pilot project, once we move past the planning phase, the intention is that we will get even more accurate cost data when we actually go out and install some systems in homes. Let's see, so another benefit of urine diversion is presents an opportunity for nutrient recycling. Basically, if we're pulling urine out of the waste stream, it allows us to process it and make it into a fertilizer product that would the nutrients in that fertilizer would otherwise be pollutants requiring treatment either in on-site septic systems or at central wastewater treatment plants. And lastly, I believe there are a lot of business opportunities associated with developing urine diversion at a larger scale. And we've already seen it a bit where there's at least one company in Massachusetts right now that is collecting urine and making a fertilizer product out of it. And I've heard interest from others around town as well that there's interest in doing this. So those are some of the reasons we're looking into urine diversion. Again, sort of more background, how does urine diversion work? This is just a really broad overview. Basically, you separate urine from wastewater at the source using specialized toilet fixtures and urinals. From that point, it drains down to a holding tank, either in the basement of the home or underground outside the home. Once the urine is stored in that location, it can be pumped out by a septage hauler or potentially town or county staff and brought to a central storage and treatment facility. Once we're in the process of pumping out, we would get an accurate measurement of volume and sample for nutrients, so we'd understand that the total nutrient content that was diverted. And then we could actually report that nutrient load diverted to the Mass DEP toward watershed TMDLs. Once the urine has been diverted and treated, it could be distributed to a fertilizer manufacturer for processing, and then the resulting fertilizer products could be applied in accordance with local and state plant nutrient rules. So that's sort of an overview on the whole concept. So where are we now? This is the reason I'm here, to give you guys an update. So most of the focus, and the reason this has taken a year already, is that we're working with basically 3 different regulatory bodies. And I think everybody here understands how that can take time, especially given that we're doing something really completely new that hasn't really ever been done before in the state. So first off, we're working with the Massachusetts Department of Environmental Protection. So far, we have confirmed and engaged with the approval process through the Innovative Alternative Septic System Program. The DEP has advised us to file a provisional use permit, which we're currently engaged with. DEP has also confirmed the ability for the town to basically account for the nutrients at the watershed scale, which is pretty big news. That was a pretty big accomplishment of the team. Given, really the alternative is trying to account for the nutrients on a house-by-house, parcel-by-parcel basis like we do with septic systems. The real benefit of the watershed scale accounting is that we can, cumulatively account for all the nutrients removed, per watershed area. So we can basically say that, we removed, X number of kilograms, in X watershed, and then report that to DEP in the watershed permit reports. And then lastly on DEP, we actually just had a meeting last week that was a very exciting meeting for us, given that the DEP basically determined that the recycling and reuse of urine as fertilizer fits nowhere in their existing regulations. Initially, they were looking at the biosolids program, which is how they manage the recycling of biosolids from wastewater treatment plants. We had some concerns about regulating urine through that same pathway. For a variety of reasons, but during this meeting just last week, the DEP confirmed that it was not going to apply that program, and basically that they were going to pass the jurisdiction off to the Department of Agricultural Resources. So essentially what DEP is saying is that urine, once diverted from the waste stream and processed appropriately, is a fertilizer product. So that was really, really big news from Mass DEP. And so that relates to the second regulatory body there, the Massachusetts Department of Agricultural Resources, or MDAR. So we have identified the pathway to register urine-derived fertilizer products. And in fact, there is now one urine-derived fertilizer product that's registered in the state. It's called We Bloom, manufactured by the company Wasted. So that's actually available for purchase and reuse in the state right now. Excuse me. Yeah, and so we have a next meeting between DEP and MDAR on May 27th, where we'll be, sort of working out the details of that sort of transition from DEP's regulation to MDAR's regulation with the urine product. And then the third regulatory body we've been working with is the Plumbing Board. It's actually called the Board of Examiners of Plumbers and Gas Fitters. We just call it the Plumbing Board. And so we've identified 2 different pathways for the approval of the urine diverting toilet fixtures. The number 1 choice is to get general acceptance, basically meaning that each individual fixture gets a registration number with the board, and then could be essentially installed anywhere in the state. If we can't get that acceptance, reason being that a lot of the toilet fixtures we're looking at are manufactured in Europe, and so they don't have the certain specifications that the state plumbing board is looking for. So in that case, we can apply for a variance for the purpose of the pilot project. We also in this process, we've learned that the application for acceptance of the plumbing fixtures, meaning the toilets and urinals, should come from the toilet manufacturers. So rather than applying for that ourselves, we're basically working with the toilet manufacturers and trying to facilitate that process of getting approval. In addition to the toilet fixtures, we also have to get approval for the whole plumbing system and the storage system. So that's something that we can do, because that's not a proprietary system, right? It's piping and a storage tank. So we've hired an engineer, and we've had the preliminary plans that we developed updated. Actually, I just got them yesterday. So we're currently reviewing those with our team and plan to submit those to the plumbing board as soon as we can. And we're expecting to get a formal plumbing board review on those plumbing and storage system plans in June. And then once we have those plans in hand, that's really going to facilitate the approval of the toilet fixtures as well, because the plumbing board is going to need to know where does the P go once it goes through that approved fixture. So once we deal with this, all the regulatory details, these are kind of next steps moving forward. We need to determine, again, planning for the pilot project, how the town can subsidize the installations of these systems and how that subsidy would be managed. We need to update a participant agreement. We already have a draft that we've developed, but that participant agreement will lay out all the details of what the different responsibilities are for the pilot project. We also need to conduct a preliminary assessment of potential participants. We currently have a list of about 200 people who are interested in participating. So my plan is to submit basically a survey to them, not necessarily going in homes yet, but surveying them to understand how many toilets they have, whether they have 2 floors, how many they'd be willing to replace, and things like that. So I'm hoping that that'll sort of cull down the list of 200 to some of basically the best sites for the project, for the pilot project. We're also continuing to explore the disposal option at the wastewater treatment plant. We've had ongoing conversations with Amy Lowell on that topic. Obviously, in our mind, the preferred method is recycling as fertilizer, but if we either can't get that or can't manage the whole volume that way, we'd like to have the wastewater treatment plant as a backup option. We are continuing with ongoing efforts to look at alternative funding pathways. The preliminary quote for the project was around $1.7 million, so we are trying to find ways to supplement that. And then, as I already mentioned, we're aligning, our timeline is basically aligning us for November town meeting to hopefully move forward with the pilot. And then, so this is sort of a preliminary pilot project concept. So assuming we complete the planning in time, we get funding in place, a spring 2026 would be an excellent start date, I think, to target. At that point, I think then we would be ready to start doing in-home assessments. So we'd have that sort of culled down list of priority sites, and that's when I think it would make sense to invest in actually going in the homes and getting the information needed to select what types of toilet fixtures could be installed and what the plumbing and storage system might look like in that home. At that point, we would be getting sort of more accurate cost numbers together for each one of those individual sites. After that, we would sign those participant agreements that we're working on, complete the system design and permitting, get the installations in. Again, we're looking to do 50 systems for 3 years. The reason for that is that fits within DEP's approval framework. Once we do all that monitoring, we would provide a report to DEP, which would hopefully confirm the nutrient accounting approach. And then if all goes well, we'd be looking to work with the town to figure out how to integrate UD, urine diversion, into town watershed planning. And that's all I had. So I'm open for questions.
Thank you, Brian.
Yeah.
Typically, we let the board ask questions, and then we turn to the audience, but if I can, I've got several questions, and I think I'll start. You said 1%, so that's 1.4 gallons per day. I just took 140 gallons a day per household, typical. How big is the storage tank in the ground?
It depends on the house, depends on how many people live there. But yeah.
Typical, 140. The typical household use is, from all the
Yeah,
work
I've seen
we've done.
between 200 and 500 gallon tanks. You know, an indoor tank generally needs to fit through doorways, so I think that's the real issue there.
Just-
But if it's a bigger household, you know,
Just trying to figure out, does it get pumped out once a year, 4 times a year,
so
twice
that, I
a
mean,
year?
that's really where the tank sizing comes from, is how often do you want to have to pump it out? So, you know,
You
it's
guys have been
sized-
looking at this. How often do you think they should be pumped out?
I think at most twice a year,
Okay,
ideally once a year.
well, thank you. Your timeline to get to a town meeting, I might put you on the spot a little bit, Peter, but typically, there's, inside some capital budget, a placeholder, and typically articles have to be prepared June or July?
No, we have more time than that.
A little more time than that, okay. Is there currently a placeholder any place in the capital budget that you know of?
Yeah.
Okay,
Yep.
okay. I'm not challenging, I'm just trying to make sure we've taken care of some of the details. You talked about 200 folks have indicated a willingness to participate. Do you know how many of those are in nitrogen-sensitive areas? Because that's what this board's concerned with.
I do not, although I guess I would say that, you know, I think it's important to look at this in phases. So I think what we're talking about now is not implementation. We're talking about a pilot project to basically understand, you know, how well the systems work, are people willing to install them, and how much nutrient content is removed. I think, you know, beyond, you know, after the pilot project, I think that's when we really need to make sure that the installations are happening in appropriate areas.
I'll express my preference that the more that are in the nitrogen-sensitive area, the better.
I absolutely agree, that would be ideal, yep.
And back when this whole issue was more on, in front of this board to try to figure out things, one of the big things we had, and we never got to a final determination, was do all the bathrooms have to be outfitted with urine diversion?
Yep.
Or just only one of them have to be outfitted?
This
Because
question again,
From,
yeah.
from our perspective, when we had this before, was, you know, if I'm sitting here being told to spend $40,000 on a more conventional IA, and I got 3 bathrooms, and I can put in a urine diversion toilet for a lot less than that,
Yeah.
I might never use it. And so then it's defeating where we're trying to get to.
Yeah.
So I would hope that you guys get to a policy point on that, and at least I'm speaking for myself, I'm not the whole board, but I think when we had this before, several of us felt that all bathrooms should be urine diversion, okay?
I guess, you know, my response to that is, you know, the watershed cumulative accounting approach that I mentioned earlier would allow for any level of installation. You know, if you wanted to put in a single urinal in your garage, you know, you could contribute to the total nutrient removal from that watershed, and we believe that, you know, we will get many more adopters if we don't require all toilets to be replaced and/or disabled.
And our goal is to have people put in an IA system that makes 10 milligrams per liter on that 140 gallons a day, so that, you've got to be able to show that you're getting there. I'll give you 1 minute, okay? Go ahead, Peter, you outrank me. I work for you.
As a member of the urine diversion working group, I did want to speak to this. And you, Steve, Peter Johnson Staub, Assistant Town Manager. Thank you.
Yeah,
Thank you.
He didn't listen to me when I said at the beginning.
So we have been wrestling with this question, and it's one that actually I don't think the working group is going to resolve. So I'm glad we're talking about it tonight, because I think it is important for the Water Quality Management Committee to look at this issue, and not tonight, but to weigh in with the recommendation before we get to funding a pilot project. Because what we do know is that if the goal of your committee is to have urine diversion as an option to replace an IA, which I think is what you're getting at, Steve, then we need to get general use approval. And in order to get to general use approval, the DEP has been very clear with us that at a minimum, the households, the 50 households that have to operate for 3 years in order to get to general use approval, which is the standard which I'm sure you all are well familiar with, those households would have to either have all of their toilet fixtures be urine diversion or disable the toilet fixtures that were not urine diversion. So we have at the working group, we have talked about an opportunity for folks to install urine diversion toilets and still have a community benefit that counts toward the nitrogen targets that we have for our impacted watersheds, but it would be analogous to oysters, not IAs. And what I mean by that is the way that oysters count toward our water quality management plan and our nitrogen credits right now is we put a bunch of oysters out, we measure them before we put them in, we weigh them as they come out, and then we do the calculation. We say, okay, this is not guesswork. We can tell you this is how much nitrogen we have removed after the fact. Watershed scale, there's a total nitrogen that's credited for that watershed. So urine diversion fixtures outside of an area that requires sewers or IAs, we could do that same calculation of, okay, it doesn't matter, we don't need to determine in advance how households are using their urine diversion fixtures. We'll just measure the urine going out, right? So we could then have a credit in the water quality management plan. This is how much nitrogen is being removed from urine diversion toilets. That's nice, that's a value, and certainly if folks want to pay for that themselves, that's terrific. But if, again, the goal is to provide homeowners with a cheaper alternative to an IA, then the pilot project should have 50 households that are only urine diversion. But there are, I just wanted to articulate, there is a benefit to other approaches to urine diversion.
Gotcha. All right, I'm gonna start. Jonathan, I'll start at your end.
Urine?
Urine?
I guess, assuming that this pilot project leads to acceptance by the DEP, I wonder if it's time to start thinking about, with our septic tax credit changes that we're proposing, and a little bit further down the road, bringing urine diversion into that mix. Right now, it's the tax credit can be applied to a connection for a sewer or for a conventional IA system, a tank that goes in your Title V system. But I wonder if we can somehow bring in UD in there, and that would offset some of the cost of these, or most of the cost of the toilets, and make it a bit more palatable for people who want to go down that path. And I'm sure someone like Senator Dylan Fernandez would be supportive of that, and maybe even David Vieira too. But something to think about down the road.
Yep, I agree, that makes sense. And I think, having it approved as a provisional use or general use IA system, I think would help facilitate that.
That's it.
Well,
Yeah, nice job, Brian.
Thanks.
Really nicely organized. I have a point that I've raised a couple times before, the 50 households. In 3 years, I wouldn't be surprised if there was 10% attrition. So I really, and I don't know what the magic number is, but I strongly suggest 65, God forbid 75. It sounds like you've got plenty of people that want to get interested. Obviously, raise it to 75, the cost of the whole project goes up by some significant factor. But I really think it's very important to keep that in mind, because I don't know how sticky DEP would be if, say, after 3 years, they had 45 households, because they've been so specific all the way along about 50 to 50.
Yeah.
There's that one. And then to really put you on the spot, and I'm not necessarily warm and fuzzy way, of the holy trinity you're dealing with, the Plumbing Board, DEP, and MDR, one by one, what's your feeling about their interest in this? Is it positive? Is it passive? Is it actively skeptical?
I think we've made a ton of progress, and actually, we were just talking about this yesterday, because, the folks, some of the consultants I'm working with have actually been working on this for many, many years, and we
Yeah.
were just talking yesterday, like, what's changed? And they really
Okay,
think it's.
good, good.
We've really developed good relationships with the regulators, and I would say the Mass DEP is very, very supportive at this point. The DAR, I think, they see it as plant nutrients.
Yep.
Like I said, they've already approved a urine-derived fertilizer, so, if they're like, there's nitrogen, there's phosphorus, there's potassium, there's nothing dangerous in it, it's a fertilizer in their eyes. The plumbing board, they're worried about engineering plans, pipes and fittings and not leaking and not smelling, so I really think we have, a great setup with the
That's
regulators.
good news.
I'm not concerned about it, yeah. Yep.
That's all I have, Steve.
Right? You're up, Steve.
In connection with,
And just for all of those who do or don't know that, Steve is our representative from this board to the working committee.
right, so maybe I should know the answer to this, but I don't. You mentioned in connection with the plumbing board that you might have to use, would likely have to use the variance for the pilot project.
Possibly, we're not sure yet.
Well, we'd have to use one or the other.
Well, the
You have to
ideal
at
would,
least have variance and, if you're lucky, general approval
for the toilet fixtures.
for the toilet fixture.
Yeah, we're targeting, general acceptance as our top priority.
Right.
And, we will settle for variance if we have to be able
Right.
to do the pilot.
So, in any case, after the pilot project, when you're going, then is it required to have general approval?
Urine diversion systems have been installed for many years under, site-by-site variances. So, no, it's just, it's a more challenging process. It's a longer and more expensive permitting process, basically, to work through a variance on a case-by-case basis, as opposed to having general acceptance of the fixture.
Thank you. That's it.
The, couple of questions. The step that you've achieved with DEP, that they'll take kilogram mass of nitrogen removed accounting and give credit is huge. That's fantastic. That's a major hurdle. Fixtures was the big bugaboo when I got heavily involved in this last fall with a working group that was under water quality management.
Yep.
Where do you stand with fixtures? What fixtures are you looking at? Because, you got estimates for install, that's plumbing. It's not the fixtures, because you need to identify the fixtures. What's the status of the fixture project?
Yeah, admittedly, I think that's the biggest challenge to overcome at this point. Like I mentioned, most of the fixtures we're looking at are European manufactured. We are working very closely with basically 3 different fixture manufacturers to try to facilitate, the approval process in the state. I think that's going well, but, honestly, I've never worked with the plumbing board. I've never tried to get a toilet approved with the plumbing board, so it's all new to me. But all I can say is I guess we're making progress, and I'm optimistic. I guess the good news is that we have waterless urinals already approved. Mm-hmm. So, that is an opportunity there, to either install waterless urinals in homes, and I understand there's a space limitation in bathrooms associated with that. But certainly in, public buildings and schools, in businesses, there are many, many urinals out there that could be converted to waterless urine collecting systems. So as a fallback, we already have that option. I think that the 2, sit-down toilet fixtures we're looking at are urine diverting flush toilets. So they basically still use water to flush the feces while they use a smaller amount of water to flush the urine. Those are the 2 that I think are, potentially a little bit more challenging. Those are the 2 that are, European manufactured. The other option I'm looking into, and actually had a call with 2 different manufacturers just today, are these urine-only sit-down toilets, which I think is an interesting opportunity because it doesn't limit to stand-up peers only. It allows both stand-up and sit-down peers to use these toilets. But it would be, in that case, a second toilet in a bathroom. Mm-hmm. So we're trying to look at all the options that we can. We're also looking at urine-diverting composting toilets for people who are interested in that. So we're trying to get as many fixtures approved as we can. But like I said, it's, you know.
Well, there's specifics you can cite, that, what brands are you looking at? The, what is it,
Well, the
Westman?
Laufin Save, the
Yep.
Wostman Eco Flush, they also
Yep.
make an Eco Dry, which is a composting toilet. There's the Separate Villa, and the Separate makes the pee-only sit-down. The Cinderella is an incinerating toilet, but they also have a pee-only sit-down toilet. So I think those are the top toilet brands, and then, you know, there's also American Standard, an American-made toilet is in process of developing a urine diverting toilet, and they're very aware of the project. We've been talking with them regularly, and they're hoping to have their fixture, you know, ready by spring 2026.
That's fantastic.
But I wouldn't, you know, it's
Yeah.
still under
Yeah, well,
development right now, but that's, you know, that's really promising news.
Yeah, the Wostman, there was a pilot some years ago, a dozen or so, in Australia, where they used it, but they found it, the urine product was too dilute because it used too much water. It used a lot more than they thought it did
Yeah.
for flushing, so they threw them away. They put 30-odd units in a series of homes, and they were gonna use the product to fertilize a turf farm, which I thought was a fantastic idea. So it sounds like you're making great progress, especially, you know, the American Standard. I know when I spoke to the executive director of the plumbing board last fall at some point, you know, he was receptive to, they would consider any toilet that was approved by a government entity anywhere in the world and say, hey, well, at least it's approved by, you know, the Australian or the Swiss or whatever. But none of the manufacturers could come up with that certification. Maybe it's improved over, you know, the past year. Couple other questions. Now, why would we consider, or the committee of yours is considering diverting excess urine that couldn't be processed into fertilizer to the wastewater treatment facility? Seems when there was a pilot done by the Green Center, wasted out of Burlington, was picking up the urine for a nominal fee, and if you scheduled the couple of time a year pickup at the houses in the program, at the very least, it would keep it out of Amy's plant and take it to Burlington, or I think they had a facility they were developing in Massachusetts. It seems like a waste of the potential resource and a delay of developing that commercial use. So
Yep.
why not waste it
I
as?
completely agree. You know, the only reason we're looking at the wastewater treatment plan is really as a backup plan. And, you know, we've been talking about that since the start of the project.
Yep.
And we've made a lot of progress toward, you know, urine fertilizers since then. So you know, I don't intend to see any urine going to the treatment plant. I would prefer not to. We're just exploring that as a backup option in case that, you know, the urine recycling, you know, process isn't in place in time. That being said, you know, you mentioned wasted. They've called me multiple times and are asking how much pee we have at the test center because they want it. And
They want it,
they
yeah.
need more urine for their fertilizer manufacturing.
Yeah,
So
they're-
there's a demand right now.
Yeah, so-
Also, the Rich Earth Institute, they have a for-profit spin-off called Brightwater Tools, where they make all of the tools necessary for processing urine into fertilizer. That includes a pasteurizer, a struvite precipitator, a carbon filter, and a freeze concentrator. And the freeze concentration is really exciting because what it does is effectively freezes out the fresh water and concentrates the nutrient content of the urine, which can reduce the total volume by up to 10 times. So that would really facilitate moving it to Vermont if we had to do that.
Right. Yeah.
Again, I don't foresee needing to do that because we're making so much progress, and, you know, we're really seeing the regulators be very accepting of making, you know, urine fertilizer in Massachusetts.
Yeah. It seems that at the very worst case, hey, wasted will take it.
Yeah.
There'll be a fee, but, you know, if you schedule bulk collections, I would think that'd be pretty nominal. One last point, that I know town meeting approved some sum of money this spring for a survey of homes to see what feasibility there is for installing. Is that going to be rolled into this project? Is that funding you're looking to utilize as part of your assessment? Maybe that's a question more for Peter.
Yeah, I mean, I think ultimately that's up to the town, how they manage those, you know, funds that were allocated at town meeting. But I mean, I do think, you know, that will be, you know, in my mind, that's sort of a first step in the pilot project.
Right.
Is to, you know, so I think we need to do a preliminary assessment now, and then I think we do need to go into those homes at the beginning of the pilot project.
Yeah, well, that's was my understanding. That fund was just for that purpose, to go into X number of homes and see the feasibility, so
Yep.
maybe Peter can answer, where is that gonna happen? And who's gonna do it?
Identify yourself for the people at home.
Johnson Staub, Assistant
Thank
Town
you.
Manager
Still.
again. So that is additional resources for preparing the pilot project, and even as part of the pilot project, it's now, I guess, a subsidy available to go to the individuals who sign up. So, I don't know that, I wouldn't foresee just sort of going into 50 homes because people are interested, right? I would want to put that money to good use, meaning let's make sure we clear all of our threshold questions, that we're willing to proceed, we're able to proceed with the pilot project, which we anticipate to cost well over $1 million, and that $50,000 will be used toward completing that process. And it may be used prior to, I don't know what the sequence is in terms of when the town meeting vote is and the authorization. But one of the points that Brian touched on is the participant agreements with the individual households. And that sounds, easy and simple. There's actually quite a lot of decision-making that needs to happen before we can hammer out the details of that participant agreement. And, and the financials is the biggest one, right? What is the town going to contribute to the cost? What is the remaining cost to the homeowner? All of that needs to be nailed down in the participant agreement. So having the additional funds that we have available now, can be used. Maybe we do, we do a couple of different houses and we do a couple of different fixture types so that we can refine the estimates that we have now of $5,000 to $15,000, and maybe the remainder is used to offset costs of the pilot project when we actually are signing, putting the details in the individual participant agreements.
Thank you.
All right. Go ahead, Steve.
Peter just made me realize that I think one of the biggest challenges is a sort of a catch-22 in the decision sequence. If I was a potential urine diversion user, I would look in the participant agreement that you're handing me to see what is the town promising me. Do I get to avoid an IA or a sewer? And obviously, if the town can make a promise like that, I'm much more likely to sign up. On the other hand, there's what the venture capitalists call regulatory risk. The town might not be ready to promise that. So then you have to be honest with the participants that you're not promising them anything. You're promising them subsidy, but not future substitution. And somehow we have to all work together to figure that out.
Yep. Yeah, I agree. I mean, that's a big decision the town needs to make. I mean, of course, I'm, an advocate of this concept, and so I see people participating in this pilot project are taking a pretty big risk. I mean, they're putting in a whole new toilet system in their home and allowing it to be monitored for 3 years. And so I think people, whether they invest anything financially, or whether they're relieved from, future mandated, IA system installations, they have quite a bit of skin in the game just participating. And so, I would hope that the town would, consider that and,
Bob's next.
make it, something people want to do, because we need to, hit these numbers to satisfy DEP. I don't think we want to make it hard. We want to make it a good deal for people who are willing to participate. That's my opinion.
Tom has another question.
Yeah, Brian, how frequently are the participating households effluent? How frequently is that going to be monitored over the 3 years?
We don't have like a final monitoring plan right now.
Okay.
So we'd be monitoring both the urine removed,
Right.
to get that number, and that really only has to happen when the tank gets pumped out.
Sure.
There's no point to sample the tank repeatedly, so it
Right.
might be once or twice a year that we're sampling the urine tank. And I think we also do want to monitor the septic tank effluent to understand what the impact of removing that urine is. So that's something we still need to iron out. I mean, for IA septic systems, we tend to do it either monthly or quarterly.
Right.
So I think that's a decision we still need to make.
The reason I'm bringing that up is I would hope there'd be a good chance we'd hit our 10 milligram per liter or better mark, and then we can go to the state and say here, the UD system is hitting our preferred or our goal for IAs, which again is I think is a key sort of pinch point in the argument.
Okay. Ed?
Yes, sir. Thank you. The, two things. One, in preparing that participatory agreement, a guideline that is worth looking at is what the town had done with people that participated in the eco-toilet program about 12 years ago as part of the Little Pond Sewer Service Area project. At that point, there was a small town subsidy, I think it was $5,000 or something, but there was also the opportunity and the guarantee that you wouldn't have to connect to a sewer if you were in the Little Pond Sewer Service Area. So you did not incur that cost, which ended up to be a little over $13,000. You also didn't have to run a lateral, which could have been anywhere from $3,000 to $6,000, $7,000, $10,000. So you were saving, in effect, in the order of magnitude of $20,000 to $25,000. Now, if the opportunity, I think that required some special legislation from the state to allow people on a sewer line not to connect as long as they were in the eco-toilet program. Nobody did it. I think 8 or 10 people did it town-wide, not in the sewer service area, and a couple are still doing it. They still have the, I think it might be the Dubleton toilet. I'm not sure which one it was. I think that's the one they used, but that's no longer manufactured. So as a starting point in looking at that agreement, that is going to be fun to draft. There's a good document there that was used a dozen years ago. And just lastly, to Tom's question about the testing, I think, yeah, the protocol in the provisional approval by DEP is quarterly testing. So if we want to get to that IA thing, which I think is really the goal of this committee and most people, to avoid the $40,000 and get a $10,000 approved IA for urine diversion, you'd have to do the quarterly testing. And I think that's important to see how effective, how quickly. I would think there'd be very quick impact at the D-blocks, and
Yep.
hope it'll happen.
Yep. Yeah, I would agree. I mean, I think, to that point, I mean, we're planning to assess urine diversion systems in, 2 ways, and we've already talked about this a couple times, but number one is as a best available nitrogen removing technology, and that's where likely, all the toilets would have to be urine diverting and or composting in the house to achieve that, 10 milligram per liter number at the septic tank effluent. But I think there's also the approach that Peter helped outline where we could look at it more like oysters or more like fertilizer reduction. And, I think, I just hope we don't lose sight of the potential value toward water quality improvement and toward meeting TMDLs, potentially at a lower cost. And, that in order for that approach to work in the town, it'll require looking at the watershed planning approach and potentially, allowing urine diversion systems in different areas and, figuring out how that interacts with, IA mandates. Obviously we don't want people to game the system and put in the cheaper UD in place of the IA. But, there could be some real benefit to figuring out, alternative ways to fit this in the town's planning approach.
Okay. I'm going to take questions from the audience, but I have a quick question to you, Kristen. I think I have the draft agenda. Where do we fit Tom in today?
Tom is third.
He's third? Okay, thank you. Okay, comments from the audience. We'll take the select board member first.
Hi, Doug Brown, Select Board. So it's true that last time when we had the sewer planning, we wanted to really push the IA, the composting toilets and really gauge people's interest. So we did offer not having to connect to the sewer. I'm not so sure that long-term that's a good plan, because if you're in a sewer planning area, you should know that eventually that house is going to be connected to a sewer. Maybe it's not the best thing to do to offer people urine diversion in sewer planning areas a pass on the sewer. I think these are really geared toward other areas of town. Personally, that's my feeling. And I hope we don't give them false hopes that we're going to allow them not to connect to sewer in sewer planned areas.
I think we've previously had a conversation, Doug, that says if you're in the sewer service area and the sewer goes by in front of your house, whether you connect or not, you get assessed a betterment.
Okay, well,
Okay?
Yeah.
but we want them to connect.
Well, it's their choice. I mean, because there's a cost of, connect, they can do things.
But given that the,
But at least,
I don't think so.
They don't have a choice. You have to do it.
Okay, my point is, if people think, fine, that wasn't my point. My point was, if people go urine diversion and the sewer comes by their house, they're not gonna escape paying a betterment.
Yeah, but also, to the other point about whether the town would support letting them keep the urine diversion toilets, I would think that the select board hopefully would support that, as they did in the past with the Mara Vista
Yep.
sewer planning, so.
Yep.
Okay,
Thank you, Doug. Other comments? Hilda?
If I could just comment on that point really quickly too, urine diversion can be used in conjunction with a sewer connection or in conjunction with an IA septic system. It would only, it would greatly reduce their water usage, reduce the nutrient content going to the sewer, make the IA septic system work better potentially. So, even though they might not get the same, credit for removing the nutrients, it's still beneficial to do urine diversion really anywhere.
Save money on the water bill.
Right.
Hilda?
Hilda Mengate, Green Center. Are you still planning to, this is to Brian, are you still planning to use water meters in all your projects? Because as I think it was Tom who said we should check on the effluent. Well, you can only check the effluent if you know how much water you use, because if you use less water because you have waterless urinals or waterless toilets, then of course the concentration goes higher proportionately. Does that make any sense? So I want to make sure that water is being measured.
Yes.
Okay, good.
Do we need more measurement than everybody has to have anyway for their water bill?
Yes.
We've thought about outdoor water usage. Ideally, we would isolate indoor-only water usage. So there's a couple ways to do that. As most of you probably know, we're doing a IA septic system project in the town of Barnstable in the Shubel Pond area. And so for all of the 15 homes that are involved in that project, they have indoor-only water meters installed. The other way to do that is to monitor outdoor water usage, so actually put meters on outdoor hoses or outdoor showers. But yeah, I think it's really important. I agree with Hilda on that comment that monitoring the water usage is very important, because you're going to see probably the septic tank effluent go up, because 4 out of 5 toilet flushes are for urine only typically. So that's a really important point.
Thank you.
Good evening, Matthew Hanley from Thomas Landis Road. I'm really excited about this. I've been, following wastewater in Falmouth for like 4 years now, and I've seen all the options that are available, and I feel like this is going to be another tool in our tool belt that's really going to give low income and our seniors an option, and also our summer residents. If you have a summer cottage with 2 bedrooms and 1 bath, that's traditionally what Falmouth was made up of. This would be a great technology, because you don't have the drawbacks of having an IA system in the winter. So I look forward to this moving forward. I think there's going to be a lot of ways that this can be used that isn't being explored right now. Large nitrogen contributors like schools and nursing homes and stuff like that. If we can use the waterless urinals and do urine diversion, that's going to cut down on nitrogen. Like, how many of our school kids are at school and are contributing urine, just urine, not feces, every day. So taking that urine out of the system is going to make a huge difference in some of our watersheds. So thank you.
You're welcome. Other comments?
Just quick ones. Peter Hargraves, thank you. I would really like on slide number 2, where you talked about the watershed scale nutrient accounting, because I saw it as a path to using urine diversion on fewer than all the toilets, because there would be some credit to people. But I imagine you're not running the test with that because of the scale of the test. You're just measuring what comes out of the individual homes and then extrapolating to a broader use. So you're not going to be doing a watershed scale nutrient accounting on this pilot. Is that And I have a board. So
I mean,
understand this.
Yeah, the goal for the pilot test is to look at both, what's removed from the household and what remains in the household. And so that would allow us, what's removed from the household is what would be, cumulatively accounted for, at the watershed scale. Whereas what's left in the home, it would be, looked at on a site-by-site basis. So it depends if we're comparing to IAs or if we're just trying to remove nitrogen from the watershed.
So for all the accounting and at different stages of the project, all the measurements occur on the site that's being studied, not out in the watershed per se with samples of the water that's going through to the river and to the estuary. I misunderstood that. Okay, so the other thing, excuse me, but I'm an elderly person and I need to hear this twice sometimes. I've been schooled that the IAs that are currently approved don't remove 100% of the nitrogen, and we get a credit for an IA for a certain amount of removal, and that's how Kristen calculated, once we put in the sewers, we'll need a certain number of IAs to reach the TMDLs. So let me stop and say, do I have that right?
Yes?
And so I don't know why we would be restricting the testing to only people who are willing to do all of their toilets. Because, in fact, I could envisage, and tell me if I'm wrong on this, that if someone used all of their toilets into urine diversion, they would actually be helping the reduction of nutrients to a greater degree than someone who put in a more expensive IA. And in between are the people like me whose house, well, I'm interested in it and willing to do it under certain circumstances, but I could never accommodate that in every toilet. But if those were included in the studies, and with our knowledge of the norms for households, we could understand how much is likely to be saved if I only use one toilet, or if I choose not to use it sometime. It would be data to say, well, this is reducing the nutrient, at least on the level of an IA, because I would be better if all my toilets were going to urine diversion. Please correct me if I'm not expressing a correct understanding of all this stuff.
I'm not going to correct you, Peter,
Okay.
okay? But somebody else is willing to.
So one thing that's very clear is if we want, Peter, if we want the urine diversions to be allowed as a substitute for an IA and as I think you're aware, Peter, we're looking at creating geographic areas where IAs will be required. And the urine diversion will never be an option with DEP approval in those areas unless we get general use approval. And that's relevant because the DEP has said we will never get general use approval unless we have 50 households for 3 years that are only using urine diversion toilets.
So, I thought that was your answer, because there was an undercurrent in the discussion that unless people capped their toilets or converted all of them, it wouldn't be counted. Correct. But I know earlier on, I don't know how many lists there are. You said there are 200 people who are candidates. I should be on one or another of those lists, but I'll be disqualified if you're looking for people only who will do all their toilets. But I think Hilda and Earl did a survey showing how many people would be willing to do this if they had to do, or able even, if they had to do all their toilets. And it eliminated 75 or 80% of the toilets, or the households.
If Peter, what you just heard was the DEP's position as to what they'll accept for 50 homes.
Okay.
You're arguing that the DEP, you don't like what the DEP's told us is the rule we have to follow.
No, actually, I'm back to the fairness and the compensation for complying with the state requirements. So back to the contract, we should be totally transparent with people that they may have to just be altruistic and do this because they want to remove nutrients, because there won't be any compensation in the form of tax credits or benefits from the town, except if they're in
Got
a
4 more
pilot
minutes.
program. So,
Let me get this-
no, I understand. I'm not spitting in the wind on the DEP.
Then they'll have to install the IAs before we grant.
Well,
Okay, we're having cross conversations here.
yeah.
So, yeah, I understand. And this is one thing that I stood up for earlier on, that unless it was an IA, it didn't seem to have much merit. And so if it could be counted as an IA because the savings in the nutrient containment was comparable to another IA that was approved, then maybe it would have an entry point for being more broadly applied at a lower cost. So if we can't do that because of the discussions with DEP, I think people ought to know up front, because that's what I'm taking away from this. It changes my point of view as a participant in urine diversion.
Thank you, Peter.
This
Did
was,
you want to
a-
respond in any way?
I do feel like there's a little bit of confusion. So DEP will allow watershed scale nutrient accounting for homes that use any number of toilet fixtures, a single urinal in the garage. If you're removing pee from the watershed and it's going to a fertilizer manufacturer, the town can take credit for that. Whether,
That's after everything gets to general use approval.
not necessarily.
Okay.
Because, I mean, right now, one of the best available nitrogen removing technologies, the nitro septic system, has provisional use approval. But it's a best available nitrogen removing technology. Once it gets general use approval, the level of monitoring will decrease, but it's still available it's still available to be installed right now as a provisional use system. So really, there's basically 2 things we're trying to address with DEP. One is just understanding how well urine diversion systems work. And, they've recommended that 50 systems for 3 years will provide us with adequate data to, do the statistics on the results and get a good understanding of how well it works. But also that same 50 system 3-year number is also what's required to get general use approval. If we want general use approval as a best available nitrogen removing technology, I agree with what Peter said, that all of the toilets either need to be replaced or disabled. But there's still that opportunity that even if urine diversion, so the other way to look at it is urine diversion could also get general use approval, but not as a best available nitrogen removing technology. If it shows that it's not meeting 10 milligrams per liter, but it's meeting, it's removing, 4 kilograms per household per year, that's still really, really valuable. And it would just be, implemented by the town in a different way. If it's not going to be an option to replace an IA mandate, but like I said, I mean, it still could be implemented in watershed plans and have, very good benefits at low cost.
Tom, you had another question?
yeah, Brian just mentioned there almost in passing, as I understand it, you don't have to remove or replace the conventional fixtures in your house as long as they've been disabled, right? I mean, as long as you can demonstrate that the conventional fixtures can't be used, then I would think that household would qualify. It's not this tremendous expense of paying to have things removed and or replaced. If you shut the water off, and there's a bunch of different ways you can do that, and put a seal on it, and,
Yeah, I mean, again, we've talked about this, throughout over the past year. And,
Yeah.
I think, the recommendation from, Mass TC and our consulting team is to not require that. To prioritize the households that maybe only have one toilet and are willing to replace that, or the households that are willing to replace all their toilets if they have multiple. Those would certainly be the priority households. But I don't think it should be a requirement of the pilot project to have only UD happening in that household. Because like I said, there's still a lot of value in people who are using partial UD systems and removing significant amount of nutrients. And I can actually point to the project that the Green Center did and we helped them out with, where we had 41 households, I think it was, use these portable, the funnel with the container on it, these portable devices. They had one of those in the household. They still had other conventional toilets in the household. And we saw nitrogen removal at a rate of like 4.1 kilograms per year, which is very, very good. just using a portable fixture. So I think it's really important we don't, lose sight of the value of partial UD systems. Obviously, there's a little bit to figure out as to how those are implemented in the future, but I really think we just need to do the study. We need to do the pilot project, allowing, we want to get that 50 number, even if they're not all 100% urine diversion. I think we need to do the pilot to understand how well it can work, and then we can, figure out how to implement it in the town planning after that.
Doug? I'm going to take Jed because he hasn't had a
Doug Brown,
chance to
Select
speak
Board
next.
again. Also, I was on the working group, and we did unanimously determine, I don't know if it was unanimous, we had one dissenter, I
Oh,
believe.
everybody, it was unanimous.
Was it? I thought so. So we also came to the conclusion that all the urinals, all the toilet fixtures should be replaced because we don't want to risk spending taxpayer money on a project and not have the best possibility of success. If we spend $2 million and then we allow people to only replace one fixture and that house underperforms by 50 or 60% compared to the ones who do replace all, and if the ones who do replace all are a minor fraction of the 50, I don't think we're going to be very successful with our results, and we're going to go to DEP and we're going to fail, and we're not going to get the approval for the urine diversion to be the replacement for an IA. So that's the goal of the project, is to have this become accepted as per general use, or at least provisional use for long-term till it's really certified. And I don't want to set ourselves up for failure by saying, let everybody just do one if they want to, because I think that'll be a problem.
Jed? I got you.
Jed Goldstone, member of the Board of Health, but not speaking as a member of the Board of Health, just speaking as a parent. So some practical considerations, just because I have to run. One thing is a human pees out about 1.4 liters of pee per day. So you probably can look this up and but I think you should think about pumping quarterly rather than just because you take a family of 5 and you're going to hit a big tank pretty quickly. So that's sort of the main thing. I had another thing and I can't remember what it is, so don't better.
I'm going to let Hildy go, and then Kim, and then Maggie. Then I'll take a motion to adjourn.
Hilda Mengay, Green Center again. Thank you, Brian. I like your approach of having people do as much as they can, and not necessarily all, because we need the data and we need as much nitrogen removed from the waste stream as quick as possible. Ultimately, it's more important to get the water clean than it is to conform to some kind of regulation that the DEP is setting to us. So I think it's really important to get as many UD as possible, to get as much urine out as possible. And one way we can incentivize also is if you say to people, if you can show, no matter what you do in your house, you can show that your effluent is the same as an IA, no matter what you do, eco toilets, urine diversion, then you have achieved it. Not just only what you have removed, because some people are home hardly ever, so you can't just measure the volume that you take and say, okay, you only did this much. We just want to look at the effluent, so measured before and measured regularly afterwards. And what we noticed in the last project is that within a short amount of time, I don't remember, George might remember if it was 3 months or 6 months, it was very stable. We measured for a long time, but it was pretty stable after a while. So that we can kind of say, oh, after half a year, we have seen that the effluent is, let's say, 10 milligrams per liter. That's great. Now we're going to measure you every year at some time. And we will give you that credit as if you're an IA. That might make it a little bit more flexible as the way you say, we can use as many toilets as you want or as few. In the pilot project we did, we had the least preferred, basically, way of capturing urine, and it was about 80% of the urine was captured that way. And it wasn't just only 4 kilograms, per household, it was only for a few people in the household. So right now, it's 2.7 people on average, 2.5, 2.7, and in our studies, it was a little bit more than 1.5. So we got a lot of nitrogen out with the very volunteer approach of using this little urinal. So it's definitely worthwhile to have people have the flexibility and get as many data as quick as possible.
Yep. Kim?
Kim Komar, Falmouth Pond Coalition, and a member of the UD Working Group representing the Freshwater Pond Advisory Committee. Just a few points. The survey that the Green Center and the Falmouth Pond Coalition did and presented you the results of in November of 2023 indicated that there's a lot of sensitivity in terms of the subsidy. And about 53% of the 91 people who responded to that survey said that they would be willing to replace all their toilets if they got 100% subsidy. When you went down to 75% subsidy, that number significantly declined. So when you're thinking about subsidies, it's going to make a big difference in terms of getting all households, a household to replace all of their fixtures or disable their non-UD ones. I've also said to this committee in the past, this is a new technology that involves like the most personal of habits, going to the bathroom. And I got a tax credit for purchasing an electric car. I got a tax credit for purchasing an AC split system. I didn't have to get rid of all my other cars. I didn't have to disable my other heating and cooling systems in my house. So the idea here is that we want to popularize a new technology. And the more barriers we put in front of people, the less we're going to get people to try this new technology. I understand that we want to try to get at least 50 households, and I agree with Tom, maybe 65, 70 households to do the 50, to do the complete conversion or the exclusive use of urine diversion. It's one reason that I have been pressing for us to consider other people from other communities. There's a lot of interest in other communities in participating in this pilot study. So I'll just leave it at that. And I want to thank all of you for the amount of time you have devoted to this topic over the last couple of years, and Peter and the town and Doug and other folks and Hilda and Earl who, really pushed all this. So appreciate it.
Maggie?
I'm Maggie McGaugh from Waquoit. I'm a member of the Falmouth Pond Coalition and Citizens for the Protection of Waquoit Bay. I think I'm sort of echoing what both Hilda and Kim have just said. I do think that the subsidy is likely to be the key to this question, that the bulk of the subsidy should go to the households that will replace all of the fixtures so that the data will go to the DEP. But I think that everyone in the town of Falmouth, wherever they are, close to the south-facing estuaries or, higher north in the watershed, should be encouraged to implement any form of nitrogen removal or phosphorus removal available. So and this goes to what Jonathan was saying, that the tax credits should be expanded to include the composting toilets in addition to urine diversion, and also black water, gray water systems, incinerating toilets, whatever the mechanism is for reducing the nitrogen load and the phosphorus load should be supported. And, as Kim says, it doesn't matter which one you use. If you use any of them, you should be getting some kind of tax benefit. So I think that would be something to really emphasize with Dylan and the other legislators. Thanks. And thank you. I second what Kim said about the amount of time that has been put into this, the amount of work done by MassTech, the amount of work done by the Green Center to popularize this, and the support from the town is fantastic.
So I'm going to make one final sort of statement, and then we're going to move on. But I was on the phone today with a gentleman who has overseen for a number of years Suffolk County's IA program. He's recently retired. We've oftentimes discussed what is the concentration of nitrogen in the effluent. They use 80. They've measured an awful lot of systems. So just taking for a moment 80 milligrams per liter and using the value put out by Hildy that 80% of the nitrogen is in the urine, that still leaves 16 milligrams per liter of urine that'll be in the effluent. So that is going to likely come out higher than the 10 from the best IAs. I just wanted to benchmark that so we're all aware of, 80 sounds like a great number, but we're still going to have something to do. I'd like to move on to the next item. We're aware that Pleasant Bay is the only location so far, although I think there's might be one or two more that are getting close to having their plans together. They do have a plan. It covers multiple communities. And John has dug down into their plan a little bit.
That's the wrong one, Chris.
That's the wrong one. That's the wrong one.
Nice color, though.
I was excited. Thought we were further along than we were.
Yeah. So, just reflecting on, people were asking some questions about what's it cost to put together the plan, what's the cost of the plan, et cetera, et cetera. This is going to be a serious dose of reality right here.
Yeah, so this presentation was really inspired by Steve Layton's question at the last meeting as to, did it make more sense to go with just IAs to fulfill the nitrogen or use this hybrid approach we've been talking about that has sewering and a whole mix of non-traditional technologies. So what I've done is I've taken the Pleasant Bay watershed plan and run it through some types of analyses. The reason being is it's really the only estuary that's the subject of a watershed permit that's been approved by the Mass DEP. And this permit was awarded in 2018. It's interesting, it only took about 3 months for the submitted permit application to be approved and then put into work. So they developed a targeted watershed management plan that combined what they call a hybrid approach of traditional, non-traditional technologies. 75% of the nitrogen removal to meet the TMDL will occur through sewering, and then 25% through a mixture of other non-traditional technologies, which I'll talk about. As of 2018, 17,717 kilograms of nitrogen per year was needed to be removed to meet the TMDLs. And it's interesting is an alliance was formed between the 4 towns that border Pleasant Bay, Brewster, Chatham, Harwich, and Orleans to kind of come up with a plan jointly and enact this together. And from what we've heard, it's been working really well. And in addition, in terms of the parcels that are involved, there's a total of 8,637 parcels. As of the 2006 Massachusetts Estuaries Project study, 7,315 parcels were developed, and there are another 900 or so that could be developed. And the analysis I'll talk about really just treats the 7,315 homes. We're not looking at any build out. It wasn't really included in their 2018 plans. So just the numbers as submitted to the DEP, what was permitted. Again, I've talked about this. There's a mixture of sewering, which is the majority of the nitrogen technology to remove, to meet the TMDL. But they're also doing a lot of fertilizer reduction, both residential, golf course. IAs compose only about 17% of the removal, and then they have PRBs that are proposed, shellfish, aquaculture, and fertigation. So they've developed a pretty robust plan, and they're now 6 years into it. So what I've done is take an approach of looking at 3 different scenarios. The base case would be the plan is submitted and looking at the cost of that plan. It's not so easy to get the numbers, but I did the best analysis I could to come up with a total cost it would take to use those technologies that are in the base case plan. And that's shown on this slide. The numbers in red show the cost in dollars per town for a total of $351 million to get to this TMDL. And the first thing you'll notice is that they're actually proposing to remove more than the TMDL, and that's due to the fact that Chatham's doing a system-wide, town-wide sewering approach, so they're taking out more nitrogen from the various sub-embayments that are feeding into Pleasant Bay. So that's why you have this 26,444 kilograms being removed. And that's the number that was submitted in 2018 with the permit. So what that works out into, basically, in a unit cost of kilograms of nitrogen per year removed, $13,275. So that's what it would cost by using this combined sewering approach and also some of the other non-traditional technologies. Now, the second scenario, I did assume that we were going to use the same TMDL number of 17,700 kilograms per year and only use IAs to get to that number. And that's summarized on this slide. And Kristen provided some information in terms of how much an IA system would remove based on the water consumption data that exists for the 4 towns. And that number is 3 kilograms of nitrogen per year. So that comes out to 5,906 homes that would be required to have that 3 kilograms per year of nitrogen in their IA system to get to the 17,700 kilograms that needs to be removed. And I used for this analysis an assumption of $40,000 per an IA system. So the total cost comes out to about $236 million, or the unit cost is $13,333 per kilogram of nitrogen per year. So it's almost identical with all the analytical uncertainty that exists here. It's basically the same number as the hybrid approach cost. But you'd be doing fewer homes involved because you're just targeting that 17,700 kilograms per year. Now, if you take into account build out, and I think the latest studies from the 5-year report that was released suggest that with build out, it's now about 24,000 kilograms per year that would need to be removed. So you would need to involve more homes to get to that magic number. And then the last scenario I did was, what if they hadn't applied for a watershed permit and they took the approach where what the DEP is saying, that we would have to have all the homes in that watershed go to the best available nitrogen reducing technology. And for this analysis, I assumed it was going to be an IA. So you have the same numbers of 3 kilograms per household. And it would take, with the existing parcels from 2006, 7,315 times the 3 kilograms would give you 21,000, roughly 22,000 kilograms per year of nitrogen removed, and the unit cost is the same for an IA system only. It's still 13,333 kilograms. So that's what would be if every home had to convert, if they did not submit a permit. So to summarize
But there'd
this,
be more homes.
yes, that's what I've got. Well, I didn't summarize, I didn't put the number of homes, but that's down here. The number of homes increases to 7,315 versus if you just did, to meet the TMDL, the number of homes is 5,906.
So I hope you have a slide where for each of these 3 scenarios, you've got the total cost to the watershed. Because in principle, politically, you could divvy it up any way you want.
So this is the table that summarizes that, but before I go to the table, I just want to put a few sort of caveats here. There are uncertainties in the cost of these, especially in sewering. We've seen the cost of escalation that occurred from Little Pond to Great Pond. So those numbers will only have upward pressure. No costs assigned to contractors. I think, Steve, you had the question last time, how much does it cost for consultants to put together these complex plans when you're using a hybrid approach? That's not really built into this analysis. That number wasn't available. And then finally, lower cost options such as UD we're not using this analysis, and they're not using the Pleasant Bay, watershed management plan, at least at this point, there's still the potential for adaptive management practices where that could be brought in, I guess, if we have IAs approved by the DEP and it's another substitute choice that we've just spent the last hour talking about, but that's not included in this analysis. And finally, the 2023 Pleasant Bay Annual Report, which I've only seen a PowerPoint summary of, I haven't got my hands on the actual report, may have some changes to the various mixes of the traditional versus non-traditional technologies to get at the nitrogen TMDLs, but that's not there. So the table again shows the summary. So the cost right now, the existing plan, hybrid plan, about $351 million, but there's a lot of uncertainty in that number. The unit cost is basically still the same. The IA-only model, because we're only doing a smaller number of homes, that cost is significantly less. And if we were to do without a watershed permit and require all homes in the watershed to upgrade to best available nitrogen-reducing technology, that number quickly goes up and starts approaching the hybrid approach if you take into account the build-out households, which I didn't do in this analysis because I couldn't find that data. But that's how it summarizes, and in all cases, they are removing the required amount of nitrogen when their plans were submitted, but there is growth, and what I've seen is the first 5 years, they've gotten pretty close to what they promised to remove in the 2018 Total Watershed Management Plan. So it's just another way to view it. This is an existing system. It's a work in progress. It represents the best case study we have right now, because it's the only case study of a watershed permit on the Cape, and we're able to look at some of their technologies and their costs. So,
Thank you.
Can you read the three numbers? No, can you just read the three numbers in the second to bottom row?
the total cost,
Just the first three digits is all that matters.
351,000, 236,000, and 293,000. 200
Million.
million, sorry.
Million.
Million.
Thank you. Thank you.
Okay. Tom?
No, I think that's a great approach, and certainly is practical and down, no pun intended here, as down to earth as we can be right now.
Ed?
Great analysis. There's a lot of numbers there, a lot of words that, people on the committee, some who are here regularly probably understand, and others who might not have any exposure to this are like, what in the hell is he talking about? But it's great. And I think, a point I always think of when you look at the IA versus the sewer is the IA is this ongoing forever cost of monitoring each site. You still got to pump out your Tidal V tank. There's a lot of, this recognizes the initial out-of-pocket, if I can call it that, investment by the town and the homeowner. You have to also, I think, in that look at what's the ongoing thing. But this is great. I mean, that's a fantastic amount of work. Well done.
Steve?
It's fantastic. What happens when you ask this at a public meeting in Chatham?
I have not tried it, so I can't speak to that.
You see what I'm getting at?
Well,
I mean, they used apparently the least value way of doing it.
yeah, and they've made the decision to go with whole town sewering, as, the way it was described in the 2018 plan. So they're gonna remove all the nitrogen, and where it goes to, that's another story.
Great job, thank you.
Yeah, I think if you folks can reflect on when I put up numbers for the intended use plans in different communities that are on there and what they're looking for. Chatham in particular is looking for quite a bit of money from the SRF. So, yeah, no, good. Questions from the audience? Peter?
Thank you.
You want that?
If you don't want.
I got it.
So, I don't want you to get Peter Hargraves. And, I really appreciate the in-depth exploration of all this. And I'm going to bring this out again, not as a critique, but because when people see this, they may not understand the many layers and the depth and what they're really looking at. And I think I said it when Steve was up here with a work in progress, talking about the cost for removing nitrogen between the different systems, or maybe among more than two systems, and that was, this, and I think Jonathan's made it clear, this is the capital investment for the system, putting it in, but the operating cost, as I've been led to believe, to understand, is different, and it may be substantial or not. I have no idea for an IA system versus paying the sewer fee. It's certainly, to the consumer, going to be an important part of the whole equation. And the other thing we haven't talked about when you talk about strategically approaching it is the opportunity with a sewering system to handle contaminants of emerging concern, pharmaceuticals and other things, because once you stick the IA in the ground, that's what you got. And until you replace it or recharge it or whatever the terminology is for the maintenance. And so the other thing I'd like to add to the discussion, and I guess this is maybe a correction to the calculations, I talked to a person who is in the business of installing IAs about the cost for my house, which I think would present some unique engineering challenges because of the system I have. But nevertheless, he said, the concrete box on the back of the truck is $30,000. And the installation and the installed cost would, today, would be 50 to 60, not 40, so.
Other comments from the audience? Okay. Thank you, Jonathan. Next up on the agenda, Tom has got some information to pass around relative to fertilizer. I think it emanates out of, did we lose Maggie? Maggie left, okay. It emanates out of the pond committee. Yeah, but Maggie's on the pond committee too. I was trying to acknowledge both of them. I'm pointing to Kim. I'm pointing to Kim. But, the idea here is, Tom wanted to put this in front of us because it's a little bit of a hot button with the pond committee right now. The idea is, I don't want to get involved in a lengthy discussion about this. He's going to present something. Everybody should have a copy of this, and I would ask everybody to do a little bit of their homework, to look at it and understand it a little bit better, and we'll put it on to the next meeting as an agenda item for further discussion. But given that it's out there, and there's some desire for unanimity between boards about making recommendations to the selectmen about what we're doing and where we're going, I said to Tom, it'd be great. Put it up there, give the overview, and move on.
First of all, I'm the presenter, not the developer or owner or anything else of this particular project, but I've been sitting in for months now, the Freshwater Ponds Advisory Committee, and from the very get-go, of course, we discussed where they should prioritize their efforts and where the low-hanging fruit might be. And fertilizer application is one of those. I mean, it's a very willful act on the part of the property owner. Either they have done it or they've paid someone to do it. And Falmouth had a position of leadership in the Commonwealth. I think the very first fertilizer bylaw that was passed in the Commonwealth and accepted by the legislature. And as best as anybody I know knows, it had zero effect in Falmouth. Am I correct? There's been not a single enforcement effort with a very clearly defined bylaw, part of Falmouth's regulations. And George, I think, George Hoyfelter sort of took the lead on looking at this and trying to think of how we might at least get started on this. Tactically, it would put the applicators in the spotlight and make them think about where they're applying the material. Strategically, it would allow us to quantify how much nitrogen, phosphorus, potassium, and other things are being spread on the soil of Falmouth. And there's a page of verbiage leading up to setting the stage for this, but I thought it was a good idea to sort of cut to the chase. And it's pretty much explained in the boxes up here, ending up down here below. The idea is we would end up finally with a data set, but it would be more or less, I don't want to say it's frictionless, but there'd be minimum effort on the part of the professionals in town to register as home distributors, applicators, whatever, of fertilizer in town. They would have to be registered, and then when they're asked to apply the fertilizer to a property in town, they would enter this database online from home, from their cab of their truck, or wherever they were, go in and say, here's the address of the property that I'm planning on doing. Does it fall under the purview of Falmouth bylaws? They would know right away whether or not they were supposed to do it, or supposed to do it, under what conditions, and the rest of these things. And they'd be getting immediate feedback, and at the same time, in effect, are being watched once the data is stored in the system. It's extra work. The town's going to have a system set up to handle this. There's going to have to be IT and other people looking at this, and of course, there's going to be economic cost involved. I don't know what the permit might be priced at, but I'd welcome any comments or questions, first of all, from the committee. John?
I guess a lot of people I know do their own applications of fertilizer, so how do we treat the homeowner who's buying a bag of fertilizer and applying it if we want to get to a true number of amount of nitrogen that's going into the lawns?
That's a real weakness in this plan, is we're not going after the individual homeowners. But as far as I know, every year, doesn't the town of Falmouth send a registered letter to property owners that fall in?
I don't think it's registered, but there is a mailing.
A mailing, yeah, maybe not registered mail, that'd be pretty expensive, but it does go out to property owners, so they've already been put on notice that they're
There's one thing
supposed
about
to do it, but again.
putting on notice versus actual enforcement are
I agree.
completely different things.
I agree, they're very, very different things, but this is, I think, sort of thought of, and George, you can speak to this, this was the easiest target, first of all, and it's a substantial volume of fertilizers, I assume, for spread, because in my neighborhood, it's every day, all day long. Even on Sundays, the landscaping trucks running back and forth and all these different things that go on. But that's the weakness, one of the obvious weaknesses.
I guess a follow-up to that, Tom, is there a way with the various nurseries around town and distributors of nitrogen to just homeowners to track that? How many bags go off the pallet each week or whatever?
I mean.
It is up there, the second.
George, you need to step up to the microphone.
Step up here, George, and I'll
You
put
can
you
use
in the
that, you can use that
driver's
one,
seat.
George, if you want to have a two-way conversation, you can use that one over there too.
I'll use this one.
Okay.
I'm old, I need something to lean against. No, the whole purpose of this was to get some initial information. So the permitting of the folks who are commercially spreading it, of course, that's tracked through a permit system. I figured we have a wonderful IT system here in town. It would be worth it. As a board, we are a committee. We were to make recommendations to the selectmen to do something. This is a way to track where commercial fertilizers are putting and whether they're putting them in the correct place, because it could be linked to the GIS system. The homeowner, of course, is gonna buy tons of this stuff. I just walked by, rows of it in the store. So that will require anybody who sells fertilizer in the town to provide inventory of what they sell. Now, what watershed that goes in, we have no idea. The first column, we'll have a good idea. You'll have at least an idea of what watersheds are getting the majority of fertilizer spread on them. The other thing, through education, this will make homeowners more aware, because they're gonna hear about this regulation, everybody's gonna hear about it. They're gonna go, oh, why are we even doing this? So we hope that it has an educational value too, because in the stores, they're gonna have to report the inventory, and the commercial applicators are gonna be telling us where they spread it. Using the GIS system of the town, hopefully to that extent, be able to tell where in the watersheds are being. And also, we know that there are a lot of folks who say, hey, that guy's always fertilizing his lawn over there. There's a truck over there. At that time, last Tuesday, they did that. We would like to make it available at least to be able to audit, to say, we got a phone call about somebody out in 14 Harry Lane spreading fertilizer again, was it on our permit list? Because they'll have to pull a permit every time. I was not thinking that there should be a cost associated with the permit, because it's basically a little IT. They're gonna punch that in their cell phone or their iPad or whatever they input the data. They're gonna say, I'm at this address, I've used this much fertilizer, here's a PKN on it. We could do, the best enforcement is the easiest enforcement. You could look at that list and make a couple phone calls just to audit it. Mr. Smith, we see that somebody came to your house, or somebody reported this person at your house. Did they put any fertilizer down? Did they tell you what that was? Do you have a bill for it? And if they don't start matching up, then there's an enforcement capability. But this is merely just to get the information, because someday we may want some real credit from DEP about nutrient reduction in a watershed. This could provide the basis for how we started. And of course, when the reductions start being shown, we might be able to get real reductions for fertilizer use in the watershed. So that was basically it. There's another thought among the committee of looking at home rule petition to actually restrict fertilizer use. But this we thought was a good first step. It's not really regulatory in that manner. It's not highly enforcement. It's just reminding people where they can and cannot spread it in the watershed, because we have a regulation in the town that can be embedded into that whole GIS tracking system, and when somebody goes to an address, it will show up as, oh yeah, that's within 100 feet of a water body and you shouldn't be spreading it that time of year. So that's what it was for. Not heavy enforcement, mainly informative, possibly moving forward to getting us some nutrient credits for fertilizer reduction.
George, I apologize. I didn't realize you were on the committee when I was looking for people that were on the committee to
Oh, yeah.
acknowledge. I didn't
Well,
realize.
I
you were-
like to keep that low profile,
Yeah, I know.
because I'm on the Board of Health.
I-
Who will
I
likely
should, I should get the short list of committees that you're not on.
Okay, thank you.
Kim, do you want to speak?
Yes, briefly. So I also want to note that the town of Nantucket, if you go on their website, they do require that any company that is applying fertilizer in town registers. They actually have to take a little, be certified. They have these online classes that the applicators have to take in order to get licensed in town. They pay $100 for a 3-year permit to apply fertilizer in the town. So Nantucket's, providing some interesting, precedent for this.
Kim, is that through the Board of Health? Who's running that over there?
It is,
It's the Board of Health.
it's the Board of Health.
It is the Board of
Yeah,
Health.
It's the Board of Health.
Sorry, I didn't mean to interrupt you.
yeah.
I did interrupt you, though.
So we're talking about 4 different things at the Freshwater Pond Advisory Committee in recognition of the fact that we've got this nitrogen bylaw, which through our discussions with the folks at Marine Environmental Science, is they've acknowledged that there's no enforcement, there's no citations being issued. So it's sort of just a paper, it's a piece of paper, and people get mailed these letters. It doesn't really make a difference. So we're talking about four things. One is amending the nitrogen bylaw to incorporate a consideration of phosphorus. We are talking about this system that George has suggested, which again will apply to commercial applicators and also ideally track sales in stores. We're talking about an educational campaign, and we're also talking about joining with Orleans and Nantucket, which have enacted fertilizer bans, and they have home rule petitions pending at the state legislature. There was I think we know this is going to be very controversial. We know that there'll be a lot of blowback. So we see this as not a quick process, but this. George and I had the opportunity to meet with a select board member from Orleans who has led the charge on their fertilizer ban or restrictions, and we understand this would be a long-term effort and a campaign. The first Water Quality Management Committee meeting I think I ever went to, you discussed, is when Eric was the chair, and there was a discussion about fertilizer, and you decided that we need to just sort of go the education route, and there was no real discussion of anything more than that. Fertilizer is a major, contributor to our problems in our waters, and as Tom said, it is an act that people engage in, and so we need to do education, and we need to do some things like this. So I'm all for this. I'm sort of excited about this, and again, I know it's a long-term effort.
So what I'm hearing is there's some concepts that the pond committee is going to embrace. We need to talk about at our next meeting and similarly embrace it.
Right.
Then it sounds to me like it's something that goes through the Board of Selectmen as a recommendation. And then if the bylaw changes, it goes through the planning board, correct?
Yeah, and I'll just tell you that I'm meeting with Maura O'Keefe. I've talked to Maura O'Keefe about this, our legal counsel.
No,
Just to review this.
We get to advise the selectmen.
Yes.
And then the next step would be to get a more
Right.
revised bylaw in place.
Right, and it would be great for us to be working together and come to the select board, with the same recommendations for this. And we also I think the Board of Health has a role to play here too.
Can I ask a quick question, or questions last?
Question for Kim or for?
Anybody, Kim mainly. I think it's a reasonable idea. I think it might be helpful to you guys if you did a really rough back-of-the-envelope calculation and you admitted that it was rough and it was unscientific and it's in a way it's not even valid, but do it anyway, of the cost per kilograms of nitrogen removed. Is it 1,000 times, it might be 1,000 times a better deal than IAs, or it might be about the same. If it was only half as good, that's not so good.
Yeah.
For different assumptions about what percent decrement in fertilizer use you think you might achieve.
Right.
It might be a good talking point for you.
Yeah.
Yeah, I would suggest that this is the sort of thing that at our next meeting we can have more conversation.
Yeah.
Yeah, well, I'm giving him a chance to come up with a number
Yeah.
before
And I
the
think
next
it's a good
meeting.
idea. I will say that the fertilizer ban that passed town meeting in Orleans has not gone into effect because they need approval of the legislature.
Yeah.
But just the process of having that discussion and doing the ban, there is a lot more talk in Orleans than there used to be about the impacts of fertilizer and the contributions fertilizer is making to the degradation of the waters in that town. So I think it's a good discussion to have, even if we can't, do the calculations, get fine numbers. We're talking about behavior change here. We're talking about education, changes in attitude, and then changes in behavior.
Kristen, nobody from Tufts is here today, right? Okay, so I'm looking at, we have 15 minutes left before we all have to be out of here. Making sure that I didn't have to squeeze somebody from Tufts in on the agenda.
God forbid we end a few minutes early, right?
I'm fine with ending a few minutes early, but I don't want to
Yeah.
run past.
Anyway, thank you, George and Kim, and
No,
back.
There is just
Back
point of information
Yeah.
for folks that are working on this, and I think it's a very important thing. The education's probably the low-hanging fruit of the process, to get people aware of what it does and get them to understand that, that green lawn on the pond or on the estuary is really a bad thing, and you ought to be ashamed of yourself. But in the town of Bourne, just this past week, had their Springtown meeting, and Article 32 passed, and it said, determine town to vote to authorize and direct the select board to petition the Mass General Court for special legislation to establish limitations on the use of nitrogen fertilizer with the goal of reducing nitrogen loading to marine water bodies. Bourne's on board too.
Bourne's
They
on
just
board.
passed it this week.
The bad news is last night, it failed to pass in Harwich, an identical motion. But it is a battle, but as Kim emphasized, and I think it was Andy Warhol that said any publicity is good publicity, right? I think it was him that said that, probably other people also. So just getting some public attention and get them thinking, why would people be concerned about fertilizer inputs, among other things? And
You better be brief, because we've got,
move on.
we've got 10 minutes.
I'm done.
It's good, because you're setting up the next meeting, Peter Hargraves.
Oh.
I don't know if Orleans has golf courses or agriculture, but the Massachusetts general law protection of those industries and the fact that they're feeding our worst problems in Falmouth, I hope that some of these considerations are going to apply to all the sources of fertilizer, including those that Mass General Law protects now. I don't know, does the fertilizer ban include the current protected
Fertilizer
industry?
restriction,
Oh, it does restrict it.
yes.
The exclusions are for commercial agriculture.
Yeah, I'm truly going to cut this off to get the meeting done. Yeah, we're entering into discussions. We've previously talked about fertilizers and the restrictions on state law and everything else, so we'll get there. All right.
All right.
I want to move on to reports of members and staff, if I can.
Yes.
And I've got one that I just want to make sure I get out there. Within the last week, the town manager received a letter from the Cape Cod and Islands Water Protection Fund, notifying us that for the Tassa area sewers, we will get a subsidy of $12,500,000 towards that project cost. With that information in hand, I went and visited with the town's finance director. The article as written has language in there that if the town needed to, they could go down the 2.5 override path. However, there is no need for a 2.5 override. The entire project can be funded within retiring debt and whatnot. So I want to make sure that everybody understands it's not a Proposition 2.5 override. That is the question 1 vote, although there's some language in there about 2.5 override. It was there when the bill was written. We've got confirmation from the state revolving fund for our funding from them, and we've got confirmation of our 25% subsidy from the Cape and Islands. So the financing has all fallen into place. We got a 2/3 vote at town meeting, and we get a positive vote on the May 20th election. We are lined up to be able to complete our application by June 1st or 30th. But that's the last step in order to secure our financing. Lock it in. That's my report.
Good, that's exactly what we wanted to hear, because we discussed that before you got here, and we had already resolved to go behind your back and force it onto the agenda during our report. Good job.
Any other committee things. You want to talk about where the legislation is?
Yeah, I mean, just
That
quickly.
quick slide there?
Yeah, you can put that up now.
The color? It's like
So
you-
just a very brief update on where the refundable septic tax credit bill sits now. So it's moved now to the joint committee hearing phase of the two-year legislative process. It's received a new number, bill number H4082, and it went to the joint committee on revenue. So the next step is that the joint committee is going to hold hearings. They'll have an opportunity to debate the bill, and there'll be a chance for people to come and talk to them about the bill. But ultimately, they can make one of three recommendations. Two of them are basically the bill dies, and one, which is called the ought to pass, means that the bill will go on for continuation of the legislative process. So I think it's important that we have people who can speak to the bill once it goes to the committee for a hearing, because I'm not sure they're going to fully understand all the intricacies of it, because the people in that committee are not Cape and Island people. So it's something that we need to touch bases with David Vieira on to see what we can do.
Who wants to be there?
further-
But I also think the Cape and Island delegation is well aware of this, and they're, if they're not unanimous in support there. Everybody that I know from other communities say that their reps know about it and are in favor of it, so.
Right,
we
but
should
they
be-
have to be on,
We have to
with that committee, the revenue.
They can
joint
walk in, they can
committee.
walk in and speak to the bill even
Yeah,
if they're not on the
they need to,
committee.
because if it dies there, that's it.
All right, the minutes of the prior meeting. Oh, do you have a committee report?
I have, I guess I'll call it an announcement. John's not here as our liaison to the Board of Health, but I think this is important because there's been a lot of discussion here and at the Board of Health over the past years plus on IA regulation. Posted last Friday in the Enterprise, May 19th at 5:30 at the high school. The Board of Health will hold a public hearing on mandatory IA for new construction. That's a significant milestone. A lot of folks, including myself, have spoken at these meetings and at Board of Health meetings about it. So the Board of Health is now at that point. They have a regulation. They're going to hold public hearings as part of the process to implement said rule, and it is the day before the voting, May 19th at the high school at 5:30. This is the first cut of mandatory IAs in the town of Falmouth. So,
Okay, put it on your calendar.
Yeah.
good work, Board of Health guys. George, you're the only one here now.
All right? Minutes of prior meeting. Tom?
You want me to suggest they be accepted?
No, I mean, you marked them up, you passed them along.
Yeah, I beat them up,
You're good.
although I didn't have to do much to them. Kristen's doing a super job, and I'll move that they'll be accepted, that they be accepted as presented.
Second.
All those in favor?
Aye.
Signify by saying aye. I'll entertain one more motion. We can chit-chat for 6 minutes or get out early.
Move that we adjourn.
I have a motion. Do I have a
Second.
second? All those in favor? Signify by saying aye. Excellent.